Hi, I'm Brianna. I'm going to take a couple x-rays of you today. Can I verify your name and date of birth? What's your name?
Jared Brewer.
What's your date of birth?
12/10/93.
Any chance of pregnancy?
Nope.
Okay, I'm going to have you put on a robe, and if you have any socks or shoes or jewelry, have you remove that.
Sounds good.
Okay, fast forward. Okay, you can have a seat, lay down here on your table. Okay, we're going to be taking a couple pictures of your leg today. First off, I'm going to do an AP distal femur. For this exam, I'm going to use a 14 by 17 inch cassette with a 40 inch SID. I'm going to place my cassette, lift up that leg. The bottom of the cassette should be about 2 inches below the knee joint and centered to midline of the femur, the thigh. So should be about right there. We want to make sure that our patient's leg is not rotated, should be in the true anatomic position, making sure that our epicondyles are parallel to the IR. Okay. Our central ray is going to be centered to the mid femur and the center of the IR. So I've got a tick mark here, should be about right there. I'm going to mark, and I'm going to shield. And our collimation for this exam will be 1 inch on either side of the leg and the whole 17 inches in length to get as much of the femur as we can. There's no breathing instructions for this exam, so beep my AP distal femur. Second, I'm going to do my proximal femur. So I'm just going to scoot this up. Okay, should be good. Our positioning will be the same as the AP distal femur, with the exception of an internally rotated foot. Our IR should be at the same level. The top of our IR should be at the level of the ACIS, which you can feel. And you can bring it up just a little bit. Okay. And then midline to the femur again. So the leg should be in the same position as the AP distal femur, only we should rotate it inward 10 to 15 degrees to place the femoral neck parallel to the plane of the IR. For this, our central ray is going to be again centered to the IR in the mid femur. We're going to mark and shield. And the collimation for this exam is going to be the same, 1 inch on either side with the full 17 inches on in length. Again, no breathing instructions, so click. That's our AP proximal femur. All right, next, I'm going to have you turn on to this side. I'll place this behind your back. You can rotate back a bit. For our lateral frog leg proximal femur, can you lift this up just a bit? Sorry. Okay, should be good. I'm gonna have the patient turn on their lateral side, affected side, and then backward towards their back, 10 to 15 degrees from the lateral position. Again, using a 14 by 17 inch cassette still, 40 inch SID, all that is going to stay the same. Our IR is going to be at the level of the ACIS. Again, the top of the IR should be at the level of the ACIS and the midline of the femur. You can bring this leg forward and bend your knee. And you want to make sure that the unaffected leg is out of the view of the central ray. We'll shield again for this exam. and the central ray should be centered to the IR and the mid femur. I don't want to poke you. We'll mark for the left side again. And for this, the collimation for this exam will be again 1 inch on either side of the leg and 17 inches lengthwise. No breathing instructions for this, so click. That is our lateral frog leg for the proximal femur. And then we're gonna do a distal lateral, so I'm just gonna pull this down. Okay. Here. For this one, if you can, rotate all the way onto your side, and then you can bring this foot forward up here. Do you want a pillow under it? No? Okay. All right, and this, the IR should be 2 inches below. Two inches below the knee joint. You want to make sure that the epicondyles are perpendicular to the tabletop in the IR. In a true lateral, make sure that the unaffected limb is drawn up and out of the way of the central ray. The IR should be at the level 2 inches below the knee joint, and your central ray is going to be centered to the IR and the mid femur. You would shield the gonads again. Sorry. And collimation is going to be again 1 inch on either side and the full 17 inches in length. So click, that is our lateral distal femur.